Order. I call this meeting to order. This is the Standing Committee on Human Resources. Good afternoon, everyone. My name is Chris Palmer, MLA for Kings West, and I'm the chair of the committee. Today, in addition to reviewing appointments to agencies, boards, and commissions, we'll hear from the Department of Advanced Education, the Office of Healthcare Professional Recruitment, and Nova Scotia Community College regarding government investment in healthcare tuition programs and the response of post-secondary institutions. At this point, I would like to ask everyone in the room to please put your phones to silent and be sure not to touch your microphone when you're called upon. Ledge TV will be controlling your microphones for you. So I'd like to ask all of our committee members to introduce themselves for the record, please, and we'll begin with Vice Chair Burns.
Hi, good morning. MLA Rick Burns for Hemmons Plains, Lucasville.
Good afternoon, everyone. Trevor Woodrow, the MLA for Richmond.
Good afternoon. I'm Melissa Sheehy-Richard, MLA for Hants West. Welcome.
Good afternoon, everyone. MLA for Clayton Park West, Adegoke Fadare.
Good afternoon, folks. Paul Wozni, MLA for Sackville Cobequid, and I use he, him pronouns.
Hi there, I'm Krista Gallagher. I'm the MLA for Halifax Chebucto, and I use she, her pronouns.
Thank you, committee members. And for the purposes of Hansard, I'd also like to recognize the presence of Legislative Counsel Killian Schlemmer to my left and Legislative Committee Clerk Robin Dan to my right. Many of our guests today have appeared at our Human Resources Committee before, so you know we usually have a bit of business that we attend to before we get to speak with you, and that is our appointments to agencies, boards, and commissions. So we'll proceed with that part of our meeting right now, and I'll look for a motion. MLA Burns.
Yes, so for our first nomination for the Department of Communities, Culture, Tourism, and Heritage, I recommend Todd McDougall, Barry Bernard, Matthew Johnson, Jason Kassouf, and Matthew Ryder be appointed as members to the Nova Scotia Combat Sports Authority.
Thank you. Motion on the table. Any discussion? All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. MLA Burns.
Also for the Department of Communities, Culture, Tourism, and Heritage, I recommend Mickey McDonald be appointed member, chair designate to the Nova Scotia Combat Sports Authority.
Motion on the table. Discussion. All those in favor. Oh, MLA Wozni.
Yeah, just before we call the question, I want to draw to the attention of the committee that Mickey McDonald donated nearly $5,000 to the Progressive Conservative Party of Nova Scotia last year. And this appointment as chair of the Combat Sports Authority comes with a $2,000 per annum honorarium funded by the taxpayers of Nova Scotia, plus another $45 every meeting that Mr. McDonald would chair. You know, the appearance of political partisanship in this appointment is one I think the committee should be concerned with.
Thank you, MLA Wozni. No further discussion. All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Health and Wellness, I move to recommend Paulette Anderson be appointed public representative to the board of the Nova Scotia College of Nursing.
Motion on the table in discussion. All those in favor of the motion say aye.
Aye.
All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Health and Wellness, I move to recommend Mark Zwicker be appointed public representative to the board of the Nova Scotia Regulator of Respiratory Therapy.
MLA Burns, could you just repeat the name again for me, please?
Martin Zwicker.
Yes. Okay, motion on the table. All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Justice, I move to recommend Denise Pictou Maloney with the legal name of Denise DeGio, I apologize, DeGios, and Thomas Jolota be appointed members to the Accessibility Advisory Board.
Motion on the table, a discussion. All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Justice, I move to recommend David Fairbanks be appointed member, Town of Amherst, to the Municipal Board of Police Commissioners.
Motion on the table, discussion. All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Justice, I move to recommend Paula Huntley be appointed member, Town of Kentville, to the Municipal Board of Police Commissioners.
Motion on the table, discussion. All those in favor of the motion say aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Justice, I move to recommend Glenn Myers be appointed member, Town of New Glasgow, to the Municipal Board of Police Commissioners.
Motion on the table, discussion. All those in favor of the motion say aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Justice, I move to recommend William Bill Chase be appointed member, Town of Westville, to the Municipal Board of Police Commissioners.
Motion on the table, discussion. All those in favor of the motion say aye. Motion is carried. MLA Burns.
For the Department of Justice, I move to recommend Julie Langell be appointed member, Municipality of the District of Lunenburg, to the Police RCMP Advisory Board.
Motion on the table, discussion. All those in favor of the motion say aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Justice, I move to recommend Peter Murray be appointed member, Municipality of the County of Kings, to the Police RCMP Advisory Board.
Motion on the table, discussion. All those in favor of the motion say aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Natural Resources, I move to recommend Donald Connor be appointed member to the Shubenacadie Canal Commission.
Motion on the table. Is there discussion? All those in favor of the motion say aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Public Works, I move to recommend Robert Batherson and Donna Smith-Darrell be appointed members to the Halifax-Dartmouth Bridge Commission.
Motion on the table. Is there discussion? MLA Wozni.
Thank you, Chair. I just want to flag for the committee that Robert Batherson is a known close acquaintance of the Premier. This is yet another in a trend of known partisan Progressive Conservative Party loyalists being appointed to boards by this committee. Mr. Batherson's track record with the PC Party of Nova Scotia is longer than some of the actual PC members serving on this committee. He was the press secretary for former Premier John Ham before becoming president of the Progressive Conservative Association of Nova Scotia. More recently, he was a candidate and worked closely with Pierre Poilievre's team federally. Now this government wants to appoint him to the Halifax-Dartmouth Bridge Commission, where he will benefit from a $3,600 per year plus expenses honorarium funded by the taxpayers of Nova Scotia. And I believe Nova Scotians deserve to know who else applied and why certain people are being recommended over others, because from where we sit, it certainly looks like this government has no issue handpicking friends who were not elected.
Thank you, MLA Wozni. MLA Boudreau.
Thank you, Mr. Chair. And I thought it would be important to just get something on the record here, because there's an insinuation that Mr. Batherson isn't qualified to be on a committee of this nature. But Mr. Batherson has been a strong community volunteer for many years across Halifax and across Nova Scotia. And I just want to highlight a couple of points to that. So he's a former chair of the Halifax Chamber of Commerce. He's a former chair of Neptune Theatre, Mr. Speaker, or Mr. Chair, and also a former member of the Halifax Stanfield International Airport. So this is an appointment of somebody who has incredible experience on a number of different boards, and will certainly support his recommendation moving him forward as a board member with the experience that you want in a commission like this.
Thank you, MLA Boudreau. No further discussion. All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. MLA Burns.
For the Department of Service Nova Scotia, I move to recommend Adam Tipper be appointed member, embalmer, to the Board of Registration of Embalmers and Funeral Directors.
Motion on the table. Any discussion? All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. MLA Burns.
And the last recommendation for the Department of Service Nova Scotia, I move to recommend Valerie Wilson be appointed member, consumer advocate, to the Board of Registration of Embalmers and Funeral Directors.
Motion on the table. Any discussion? All those in favor of the motion say aye. Aye. All those opposed, nay. Motion is carried. So we'd like to thank our guests for the patience. Oh, MLA Mumbercat.
Just for the record, Mr. Chair, I apologize for being a few minutes late. I just want to get on the record that I'm in attendance. I was never late for work when I worked at Marconi campus, ever. But I just want to get on the record that I'm here just for the folks in the back. Thanks.
Thank you, Member Cat. I was about to get to that, so thank you for taking the lead. I appreciate that. Thank you so much. Okay, so we will now move on to our guests and our topic for our meeting today, government investment in healthcare tuition programs and the response of post-secondary institutions. We'd like to welcome you all here today, and we can begin with introductions of the table, and then we'll get into our opening statements after that. So maybe we'll begin on my left with Ms. Wadden.
Great. Good afternoon, Lindsay Wadden. I'm Senior Executive Director at Advanced Education.
Good afternoon, Tracey Barbrick, Deputy Minister of Education, Early Childhood, as well as Advanced Education.
Good afternoon, Kim Barro, Associate Deputy Minister, Department of Health and Wellness.
Good afternoon, Kathleen DeCoste, Senior Executive Director with Health and Wellness in the Office of Healthcare Professional Recruitment.
Good afternoon, Mr. Chair and members. Don Bureaux, President of the Nova Scotia Community College.
Good afternoon, Connie Fisher. I'm the Dean for the School of Health and Human Services at NSCC.
Thank you. And we'd like to offer our guests some opening remarks. So I'll begin with Deputy Barbrick.
Good afternoon. Thank you for the opportunity to join you today to speak on behalf of the Department of Advanced Education about government's investment in healthcare tuition programs and the response of post-secondary institutions. I appreciate being here today alongside my colleagues within the department, the Office of Healthcare Professional Recruitment and Nova Scotia Community College. As you all know, healthcare professionals are the backbone of our healthcare system. From doctors and nurses to paramedics and medical lab technologists, demand for healthcare workers continues to be high. At Advanced Education, we collaborate with sector partners to understand their current and emerging workforce needs. With those priorities in mind, we work with our post-secondary institutions to ensure training and education programs are aligned and responsive. In the health sector, we work closely with the Office of Healthcare Professional Recruitment to identify gaps in the system, both now and into the future. They have deep insight into the sector, maintaining close connections with Nova Scotia Health, the IWK, Emergency Health Services, and other key healthcare providers. Drawing on this information, we partner with our post-secondary institutions to determine the most effective way to meet those workforce needs. Universities and colleges are critical in training the healthcare workers our province needs. There are approximately 50 different health professions supported by post-secondary education. Out of Nova Scotia's universities and colleges, health education programming is provided by 6 universities, 12 Nova Scotia Community College campuses, and 16 private career colleges. And in 2024-25, we invested more than $44 million in healthcare education initiatives, including the delivery of the CCA and Practical Nurse Pathway pilot program in the Truro campus, the continuation of 120 additional permanent seats in the LPN program, and an increase of 180 LPNs across the province for a total of 445 seats for the 25-26 academic year, and the reimbursement of tuition and fees of eligible students in this continuing care assistant program. Dalhousie University, as a significant provider of health education in the province, received funding for programs for nurses, physician assistants, allied health professionals, and social workers. Specifically, Dalhousie has been supported for the ongoing delivery of their Bachelor of Science Nursing program, the delivery of a 2-year Master of Physician Assistant Studies program, the final year of the Afrocentric Bachelor of Social Work cohort, the delivery of the Master of Nursing, Advanced Practice, Mental Health and Addictions program, the medical school, including funds for the continuous seat expansion with a focus on rural and underrepresented groups, and the creation of 10 additional medical seats for a total of 135 between Dalhousie and CBU. The delivery of a master's level occupational therapy program and a master's level physiotherapy program. Permanent seat expansion in the nurse practitioner program for a total of 60 seats a year. the promotion of Francophone and Acadian participation and success rates in regulated health programs, daily operations of the Dalhousie School of Social Work Community Clinic, and the Yarmouth Nursing Satellite Site. We also provided targeting funding last year for the new Cape Breton Medical Campus, delivery of a Bachelor of Science in Nursing program at St. FX and CBU, operation of the Bachelor of Science in Nursing Satellite program at Acadia University in partnership with CBU, the first 5 academic years of the Doctor of Psychology program starting in 26-27 at Mount St. Vincent University, establishing the all-new nursing office to strengthen all-new nursing education across the province, seats for the Medical Laboratory Technology program through the Michener Institute for Students in Nova Scotia, and the purchase of 12 seats for Nova Scotia Francophone medical students at University de Sherbrooke. The path forward is clear. Together with our post-secondary partners, we will continue to ensure programs reflect the needs of the healthcare system. When we invest in healthcare education, we're investing in stronger, healthier communities. We look forward to continuing these important relationships as we work to offer post-secondary students the education they need and deserve for this province. Thank you.
Thank you, Deputy Barbrick. ADM Barro.
Thank you. Is it on? Thank you. Good afternoon, and thanks for the opportunity to join you here today. Joining me is Kathleen DeCoste, our Senior Executive Director for the Office of Professional Healthcare Recruitment and Health Human Resources at the Department. Kathleen and I will do our best to answer your questions today within the scope of both the office and the Department of Health and Wellness. The demand for healthcare continues to grow. To meet that demand, we are focused on how we can transform our healthcare system to meet the needs of an aging population, like initiatives that support new, enhanced, and expanded programs and services, and opportunities that increase and improve access to care for patients in their communities. As the demand for healthcare grows, so does the demand for qualified and skilled healthcare professionals, more doctors, more nurses, more healthcare providers of almost every type, designation, and specialty. Access to education is a critical part of our broader health human resources strategy. We are working with our colleagues across government to build capacity and ensure that our health system remains sustainable and responsive to the needs of Nova Scotians now and into the future. There is a worldwide shortage of physicians, and we are not immune, so we looked long term. We added new medical school at Cape Breton University, which will train 30 new doctors every year to practice in rural Nova Scotia. We did the same with nurses, adding 400 more seats at our nursing schools. We also looked at how we could make it easier for healthcare professionals to come here from other places. We passed the Patient Access to Care Act that helps streamline those processes. We also created the Physician Assessment Center of Excellence. This center is the first of its kind in North America and will see internationally trained physicians get licensed faster to practice in communities across the province. PACE will assess internationally trained physicians while at the same time providing much-needed primary care services to Nova Scotians. PACE will serve as a primary care health home, and it will attach patients who are waiting for a family doctor. Over time, the center will expand to assess 45 new candidates a year across multiple sites in the province, focusing on assessing internationally trained physicians for primary care practice and hospitalist medicine in Nova Scotia. As PACE grows in its capacity to assess internationally trained physicians, it will also grow in its ability to provide health care to Nova Scotians. When fully operational, PACE expects to provide attachment for the provision of primary health care to 6,500 Nova Scotians. We are working with our partners at the College of Physicians and Surgeons of Nova Scotia and the Medical Council of Canada to put new solutions like this in action. We are also creating opportunities for healthcare providers to advance their careers in Nova Scotia. In 2021, government expanded eligibility to allow for criteria to allow more LPNs to qualify for the Bachelor of Science in Nursing programs at Cape Breton University and St. Francis Xavier. Last year, we announced that the province would cover the full cost of tuition and books for 30 future LPNs who agreed to work in continuing care in Nova Scotia for 2 years after graduating. The province offers a job to all graduating nurses from a Nova Scotia program. And further incentives to our nurses, we began a $10,000 retention bonus for nurses who commit to staying in Nova Scotia. We also cover salaries for 6 RNs while they attend the Dalhousie 2-year Masters of Nursing MP program in exchange for 5 years of work in a designated community. And government will invest $900,000 over the next 2 years in this round of nurse practitioner education incentives. For paramedics, we provided more than $6 million to cover full tuition costs for more than 460 people who want to become a primary care paramedic or emergency medical responder. We now train emergency medical responders, a new role, to help keep more ambulances available, reducing wait times, and allowing paramedics to focus on emergency calls. Nova Scotia is a great place to train and work as a healthcare provider. We have great compensation and incentives for family doctors, nurses, and paramedics. We are home to world-class post-secondary institutions, and we're committed to continuing to work creatively with our partners across government and academia to grow our healthcare workforce. Thank you, and I look forward to answering your questions today.
Thank you, ADM Barro. Mr. Bureau.
Thank you, Mr. Chair, and again, good afternoon, everybody. What a pleasure it is to be joining you today with my colleague, Connie Fisher, our Dean of our School of Health and Human Services. Mr. Chair, with the ever-pressing priorities facing our government, we can confirm what an important and critical investment these tuition programs are to the college and, most importantly, to those who have benefited from them. We know to be true that not only do these programs provide greater access for learners that might feel that post-secondary education is out of reach, but we know to be true that these initiatives immediately bolster the enrollment of students who, once they complete their studies and training, will find and fill key employment positions in important caring professions like practical nursing and continuing care. At NSCC, we continue to partner with government and industry partners to work more strategically with the aim of encouraging and preparing more individuals to serve in and therefore address high-demand needs in critical fields like health. And by strengthening our current collaborative efforts, including supporting underrepresented communities, upskilling and creating pathways from one profession to another, and augmenting current resources, we know we can move more quickly to achieve the goals we each hold for our province, the healthcare system, and importantly, the communities that we serve. Mr. Chair, you and the members have already heard from our colleagues a number of the important initiatives that illustrate the college's work related to today's topic, including our continuing care tuition support incentive program, our continuing care to practical nursing bridge program, and our first ever accelerated practical nursing program, of which we've completed 2 of 3 pilots. And Mr. Chair, I have the opportunity, as do many of my colleagues, of actually sitting down and speaking with students and graduates who benefit from these programs, are able to pursue careers right here in Nova Scotia. Recently, in speaking with 3, one, to quote one of our recent learners, I would never, ever even let myself dream of going back to school until I found out I would qualify for this initiative. I feel extremely lucky to have this opportunity, and I'm happy that when it's all over, I'll be able to help my community by working at our local nursing home. Second, a learner said, it has lifted a lot of stress off me. I always wanted to attend post-secondary, and this has given me the freedom to do so. I had children early in my life, and now I feel it's my time to further my education and start a career. And finally, a graduate said, this support makes me feel valued and shows that government places a priority in the program and that it's an important job. Mr. Chair, we're proud at NSCC to be an access college, and one of the proudest stats that I can recite is that almost 40% of our students are the first generation in their family to attend post-secondary education. And many of these words I just shared remind us how important these recent supports are in opening up additional opportunities and offering a needed boost to help build their future and ours as a community. Discussions are always ongoing with our partners seated here today on additional initiatives that we can incorporate into our work to further immerse our healthcare system with the professionals that they need. I'm very proud of those learners, and I'm very proud to be here today. And I'm also very proud as a president of a public college, of which there are 150 in Canada. I often get called by my presidential colleagues across the country who want to come to Nova Scotia and learn firsthand of the innovative programs that we're working with our industry partners and our government partners. So again, thank you for the opportunity to speak today, and Connie and I will be most happy to answer any questions that you might have. Thank you.
Thank you, Mr. Bureau. And we'll now enter into our question and answer period with the members of the different caucuses. Just a quick reminder again to wait till we reference your name before you speak into your microphone. And we will have 20 minutes from the official opposition, 10 minutes from the third party, and then 30 minutes from the government caucus in the first hour. We will do a hard stop at the 20 minutes. So if you're in the middle of comment, we'll have to cut you off, just so you know how the process works here, okay? So we will now move on to the official opposition, and it will be MLA Wozni.
Thank you, Chair. I'd like to direct the first question to the Department of Advanced Education. We know that understaffing is a major issue across the healthcare and long-term care sectors. The government has committed tens of millions of dollars to cover the tuition of continuing care assistants, paramedics, and licensed practical nurses. And yet Nova Scotians continue to experience long waits in emergency rooms and to get into long-term care. Stats about how much the government is spending on recruitment is not in and of itself a metric of success or impact. And so I have a few questions that really explore what the department is doing to ensure these investments are translating into improved health access for Nova Scotians. So my first question is, how is the department measuring success for the programs the government is covering tuition for? And perhaps as a starting point, we can look at what the graduation rate is for candidates under this umbrella of programs.
Deputy Barbrick.
Yeah, thanks for the question. And like any, the continuum of healthcare needs really translate from post-secondary into employment, orientation, recruitment and retention as an employer over the lifetime of an employee. So I think my colleagues at Department of Health and Wellness and Office of Healthcare Recruitment will talk a bit about that the education piece is one component of a much larger picture. So one of the things, of course, that we're doing with all of our partners, from NSCC to our universities, is a commitment to ensuring that every one of our healthcare seats are fully utilized. So you would have seen a bit of a celebration yesterday that our additional 1,800 seats in healthcare across universities. That does not count our friends here at the table, but on the university side, that 97% occupied for all of those 1,800 healthcare seats was a target for them in their bilateral agreement. And we celebrated yesterday that we have achieved that, with one small exception of St. Anne that is 2 seats shy in their social work program. But every other healthcare program across the province with our post-secondary colleagues is fully occupied and meeting the commitment that they made in the bilateral. So that is step one. The success of the students throughout that program and the kind of 5-year follow-up assessment to students, all universities, NSCC as well, does track student success over time. I know I've seen recently NSCC's something like, 90%, and they can fill in the details, 90% of the students that graduated are expressing high satisfaction with the program they were in and attachment to a workforce in their field. So we work with all universities to ensure that those seats are occupied and remain occupied throughout the program. They provide enrollment stats to us, and in their bilateral agreement, there are multiple dates that enrollment is reported to us.
Thank you. MLA Wozni.
Thank you for discussing sort of the enrollment rate in these programs. My question is directed at, despite the fact that these programs are 97% full in terms of X amount of vacancies and X amount of students, my question is, what is the graduation rate for this suite of programs where the government covers tuition for candidates engaged in learning in these programs? So I'm looking specifically for graduation rates for the entire sort of sphere that we're talking about.
Deputy Barbrick. Deputy Barbrick, there we go.
Thank you. So we have, between employers and educators in each area of healthcare, collaborative sort of industry tables, if you will, around continually ensuring that the students that come through the programs are meeting the needs of the workforce. So graduation rates, universities are highly motivated to ensure that their seats remain occupied because they're funded when they're occupied. So their tuition revenue that comes from the seats is a high motivation of theirs to ensure that they are successful. The actual graduation rates for each university I don't have with me today.
MLA Wozni.
Perhaps the deputy could furnish those graduation rates to the committee as a follow-up. We know that one of the major, continuing with the Department of Advanced Education, we know one of the features of the programs we're here to discuss today are return of service agreements for continuing care, long-term care, paramedics, and LPNs. So to qualify for these programs, there has to be a signature or commitment to return of service. I'm wondering if we can hear about how many of those return of service agreements are broken, and if so, what efforts are being undertaken to learn why those who choose to leave service in the profession, what are the reasons for that? Why are they not honoring their return of service commitments?
Deputy Barbrick.
Yeah, I can't speak to the return of service. Those aren't administered by the Department of Advanced Education, so my colleagues might have more to offer on that.
MLA Wozni, do you want to redirect the question?
I'm not sure if Ms. Barro is in a position to answer the question, but I think it's an important question for this committee to have input on.
ADM Barro.
Sure. Thank you for the question. I don't have the exact stats, but what I do understand is that for many professions, the return of service and the commitment to that is not a problem. They stay. One of the reasons that we ensure that we have offerings in many different parts of Nova Scotia and different programs is that people in those communities go into those programs because they're from those communities. They want to go back to those communities and serve those communities. So the return of service for Nova Scotians in these programs, I can't say for sure, but I've never heard it to be a problem from an employer perspective. So Nova Scotia Health is not saying that their nurses are not completing their return of service. Sometimes we don't have our physicians that stay for return of service, and I think that's mostly for internationally trained physicians. They tend to potentially go to other more cosmopolitan places that have communities bigger than what is in Nova Scotia. So sometimes that is, but for most of the healthcare professionals, I would say that the return of service is not an issue.
Thank you. MLA Wozni.
I mean, I appreciate that the answer appears to be anecdotal. I guess my question is, what system efforts are being made to monitor this as a metric of the success of these programs? And if we are not monitoring how often return of service agreements are breached, in providing free tuition for programs. Many of these programs are rapid condensed programs. There's a loss to the people of Nova Scotia who paid significant funds to see people all the way through. If this is not a metric currently in place, it begs the question as to why not. A follow-up question really has to do with the attrition rate. So post-graduation, 2 years after, 5 years after, what is the attrition rate? How many people that graduate and enter sort of the professions that they've trained to work in remain in those professions and delivering impact? So I'm wondering if somebody, whoever best positioned to answer the question, can speak to how attrition rates are measured and tracked by the government, and what the statistics are for attrition for paramedics, continuing care assistants, and LPNs that come through these condensed tuition-covered programs.
So is that an open invitation to any of our panelists that would like to speak on that, Emily Wozni, or do you want to direct that to who would be the most appropriate that would like to take that question? Deputy Barbrick. Thank you.
Yeah, thanks for the question. We had a conversation about this, I think, another time when I was in here about another profession that escapes me right now. But I think the question is, do we track individuals over time as they move kind of throughout the world or the province or the country or the globe? So a number of things happen right now. Certainly the post-secondary institutions and NSCC would be able to speak to how this happens for NSCC. But I graduated from St. FX and Dalhousie, and I occasionally get surveys from those universities asking me where I am in the world. I may or may not choose to answer those questions based on my own kind of comfort providing that. So I think a challenge is, as graduates from your program, they can choose to provide personal information about themselves or not. We don't currently have a system in this province where an individual would have an identifier that we track them through the life of the person. So right now, the post-secondary institutions do follow up with their graduates to ask if they're still working in the sector. That's often up to about 5 years. And then people move on in their life. So we aren't able to track a person's attrition to their profession. Every regulated college would have numbers for kind of profession in and profession out on an annual basis, depending on how many people have a license, but not at the individual level throughout the life of their career. We don't have anything like that. Very powerful, though.
Thank you. Emily Wozni.
Yeah, certainly not suggesting we track people throughout the entirety of their career, but we know new graduates, gone is the generation that's willing to suffer through the initial slog of 2, 5, and 10 years to get to the sweet spot of a career. Generation Y and Z are much quicker to make definitive changes in their work lives when working conditions and work-life balance are not sustainable in their view. There's a bit of a social contract here. When the people of Nova Scotia fund somebody and they sign on a dotted line that they're going to stay and work in Nova Scotia, the people of Nova Scotia should be able to count on those promises being kept. And so the gap, the inability of the department, in the different organizations, so whether that's health authorities, but when return of service agreements are signed, for there to be no ability to monitor if people are leaving the profession after 2, after 5, after 10, sort of key milestones early career, it really mitigates the government's ability to monitor whether or not this spending is delivering longitudinal impact. And we think that's a pretty important feature when you are making, a very necessary investment in healthcare in Nova Scotia. I want to transition to a different question for the Office of Healthcare Professional Recruitment. We often hear from people who work in our hospitals and other health facilities that they're overwhelmed in dealing with difficult working conditions, including understaffing. At the Cobequid Community Health Centre, We have an emergency room with no inpatient capacity, which often leaves staff concerned and stressed about their patients when they can't be transferred in a timely way to another facility that can take on their care needs. Staff at this location tell us that they are choosing not to stay long-term at sites like the Cobequid because of structural working conditions. I'm wondering if you can speak to what you're doing to address staff concerns that mitigate retention at places like the Cobequid and other understaffed and under-resourced hospitals.
ADM Barro?
Yes, thank you for the question. One of the things that we're doing is to increase our ability to bring in hospitalists. So we brought in the Physician Assessment Center of Excellence, which initially the focus was in primary care and bringing primary care physicians, but soon realized, to your point, that we need more physicians to be able to work in a hospital setting for those for those various reasons that you have mentioned. So we established through PACE a new program that will bring in 4 new hospitalists every year, and that will be through the 2 program sites are the Dartmouth General, which just started, and it's at capacity. They're doing 2 hospitalists right now, and then the Colchester East Hants will bring on 2 more hospitalists in the winter, and so having 4 new hospitalists coming into the province to help with these things, that's an example of an initiative that we've taken seriously in terms of how we will address in a short term some of the conditions and some of the stress that we have in sites like Cobequid.
Thank you. Emily Wassey with 4 minutes and 30 seconds.
Sure. Following up with the Office of Healthcare Professional Recruitment, we know parking issues in the Halifax Regional Municipality have been impacting staff's willingness to work at some of our largest and busiest hospitals due to inflated costs, but also safety concerns when they have to find parking options far from their work site. How is the department tracking and reacting to policy implementation like free parking and its impact on retention, especially among new grads that we need to recruit and retain going forward?
ADM Barro.
So the implementation of free parking for staff and patients was a very important move forward to help with making the trip to work and your ability to get to work on time very important. So we have established in the Halifax area several hundred new parking spots for which staff can have. There's a monitoring and a valet service so that we're actually monitoring if folks come into our parking facilities and they're not either staff or patients and family, and have the ability to issue an issue ticket to those, so as one deterrent not to have inappropriate people take up those very important parking spots for our staff and our family.
Thank you. Emily Wasney.
Thank you. Final question for the Office of Healthcare Professional Recruitment. Obviously, with the investments that are being made in these programs, we want the healthcare graduates from these programs to be able to succeed and remain in Nova Scotia. Can you speak to what the government is doing to monitor and address external issues that impact retention, such as affordable housing and escalating rents? And more particularly, how is the housing crisis across Nova Scotia impacting the retention of new grads?
That ADM Barro?
So part of the reason that we have instituted several new programs in different rural areas to ensure that people from those areas can attend those schools and it doesn't add to a housing crisis. So that's one of the strategies, is making sure that we have programs and supports close to home. The housing crisis is real, and I actually can't speak to how that is affecting retention of our new recruits. However, we do feel that if people are coming from a community, going back to the community, then the housing options would be less of a crisis.
Thank you. 1 minute and 20 seconds. MLA Wozni.
I guess looping back to that question, it's interesting. I appreciate operating programs in communities so people don't have to leave their homes, but the housing crisis is not unique to Halifax. Even when we operate programs in places like Digby and Yarmouth, we know there are bidding wars on new apartments. The vacancy rates are so low that landlords basically say, "Make me an offer." And so we're sort of keenly attuned to that the pressures that a lack of affordable, sustainable housing is putting on new graduates to be able to go and remain. It's one thing to live at home with your parents, but when you want to move out and have a place to live, it seems to me that one of the things that government should be monitoring is whether or not, if people are leaving the province and breaking return of service agreements, and a key factor is I can't afford to live here, that's an important factor that should be tracked and monitored. I'm just wondering what efforts could be taken by the department to start to keep tabs on that.
Ms. DeCoste. 10 seconds.
Thank you so much for the question. I suppose in 10 seconds we would just say we are certainly aware of the issue, and we're working closely with our colleagues across government, including Build Nova Scotia, Public Works, Nova Scotia Health, and others.
Thank you. MLA Mumbercat.
Thank you, Mr. Chair, and thank you to all the witnesses today. Good to see you all from the department. Good to see you from the college. My first question, I only have 10 minutes, so I'm just going to jump right in as quick as I can. In 2024, the Progressive Conservatives platform promised to establish an internal travel nursing team. My first question is, how much progress has been made by the government establishing this agency?
Ms. DeCoste.
Thank you so much for the question. Good progress has been made. Certainly, we're working closely with Nova Scotia Health in the rollout of that pilot project. So, as you know, critical shortages require really innovative solutions. And in working with Nova Scotia Health, I believe in key zones, they're starting to roll out a pilot program. There's been a lot of interest from the base nursing workforce, especially younger nurses, with the option to travel, to experience some of the unique health service offerings in different communities around Nova Scotia. So we're seeing from Nova Scotia Health, early results are indicating a good uptake from nurses, especially younger nurses, in that pilot program, the internal nursing rotation that you're mentioning. But it will take some time for the system to roll something like that out across the province and gradually reduce reliance on agency nursing. But so far, so good. We'd be happy to get back to you with some additional information.
Thank you. MLA Mumbercat.
Thank you, Mr. Chair, and thank you for that. Yeah, if you could provide the committee with any kind of timeline to when the plan is to roll that out across the province. My next question is around LPNs and the hourly wages for LPNs across the province in the country. In 2023, the government offered LPNs working in the public sector a $10,000 retention incentive. My question is what's the plan for the actual wages for LPNs in that program? There's been a lot of conversation around hourly wages, and if I can get an update on that, I'd appreciate it.
A look for direction. Is that?
Oh, sorry.
No, I just we'll let the guest decide who will. Ms. DeCoste.
Thank you so much for the question. We may need to get back to you with some of the specifics on that front. Okay. We'll need to step Nova Scotia Health.
MLA Mumbercat.
Sorry.
Yeah, and the reason why I asked the question is because the question really becomes around, you provide an incentive versus actually just providing the hourly wages to the workers. I would argue there's lots of incentives. You know what I mean? I was on that side too. We looked at various incentives for various programs, but in this case, there's a lot of conversation around the hourly wages. So I would argue that incentives are one thing, but move towards getting the wages in place for those workers. And what's the most common reason that LPNs leave the workforce here in the province? That's my next question.
Ms. DeCoste.
Yeah, thanks, and appreciate the question. Thank you for the question. Certainly, as you said, wages, incentives, and financial compensation is critical, especially in challenging times and prices of goods and services are going up. We want to make sure Nova Scotia is remaining competitive, and we know we certainly are competitive. And we also know that there's a lot of other factors that, as you said, contribute to a safe working environment for LPNs, RNs, and all staff in hospitals. So we're certainly highly focused on safety in the workplace, highly focused on making sure that there's career progression opportunities for nurses in our system, as some of my colleagues have spoken about. As an LPN in the system, you may have started as a CCA, or you may have started your journey as an LPN and have the opportunity to bridge to a registered nurse, and even from there, the opportunity to become a nurse practitioner. So career progression is also a significant area of interest for folks working in our system. And safety, I guess those are two things, as well as, of course, the culture of the workplace. And so we're working closely with our partners, Nova Scotia Health, IWK, our educational partners, to make sure that the practice environments are welcoming and that the integrated learning is reflective of what those clinical settings are with folks going into them.
Thank you. MLA Member Cat.
Thank you, Mr. Chair. This is around the accelerated nursing program. This has come up a couple of times with me on the island. The pilot program was offered at NSCC Ivany campus in Dartmouth. If the tuition program becomes permanent, what other campuses will be offered the program? I use Cape Breton as an example because I had a number of families reach out who want to take the program. Travel is a concern. Housing is a concern. Are you looking at expanding that? It would help a lot of folks that would want to take the program. It could go to the people who give the money or the people who provide the program.
Look for a little direction. I'll pick somebody. So, Ms. DeCoste, do you want to take the lead on this? And then anyone would like to, Ms. DeCoste.
Sure, I would hand it to my colleague next to me.
Okay. Mr. Bureau.
Look, certainly all of our programs, we would be analyzing the local demand, the local need on a continuous basis, and our hope, without a particular campus in mind right now, we would be hoping to expand that to other locations. It's been a very successful program. Students like it, our industry partners like it, so this is for me, it's a winner. Yeah.
MLA Member Cat.
Yeah, and I agree. We dealt with a few situations on the island where families were reaching out. They just couldn't find housing, and they just, they have families, right? And they're trying to, better their life and expand into the healthcare system. So, that's one of the big messages for me today. If you could look at expanding something like that, that would be great. How much time do I have left, Mr. Chair?
3 minutes and 50 seconds.
Just flies by, 10 minutes, I tell you. So I guess my next question, I guess we'll go to NSCC. We're here talking about a lot of programs, healthcare today, childcare one day, you know what I mean? There's been a lot of great partnerships with the community college since my time, particularly in this world. We're talking healthcare today. If there was a program that could be offered that would help support it, what is it? Something to expand on, Mr. Speaker. Through you, Mr. Chair.
Mr. Bureau.
I'll give you a direct answer and an indirect answer. Certainly you hit on one. The bridging program is obviously a very successful one, so the opportunity to expand that in the future. But we've also expanded other non-health related programs that create the conditions for the health sector to thrive. For example, with support from our government partners, we've increased our trades programs by 180 seats and made a number of connections with the apprenticeship agency to make sure that more students can pursue a career in the trades to build those houses and apartments that we need. So at the college, we're looking at this as a multi-pronged approach where we need to look at all of our programs. And the last thing that I will say is that from a housing point of view, the college traditionally only had one on-campus residence. It was in Truro. We've added 5 to that over the past few years, and we're looking to add 4 more. Those on-campus housing projects are also an important cog in this wheel to make sure that the students can get the housing they need when they're learning.
MLA Member Cat.
Okay, thank you. Thank you, Mr. Chair. I guess my next question is around, I want to go back to the incentive versus the wage. Well, I don't want to say incentive versus the wages, but incentives, I would say, transforming into eventually which will be a higher wage for those workers, which we hear a lot of. Do you feel like the incentive has worked? Like, do you feel that there is anything that could have been done better around just, providing that incentive, maybe some of the incentive, aside from the monetary piece of it, is there anything else you're looking at for incentives for folks to enroll in these programs and to expand?
ADM Barro.
We do feel that the incentives work. Just to go back to pay, since I found my notes. At the time of the agreement, all LPNs, registered nurses and nurse practitioners were at the top of the scale for Atlantic Canada. So we actually think we're doing very good in terms of wage compatibility across the sector. In terms of the incentives, I think that one of the approaches that we are doing, particularly in the nursing, is ensuring that we have a career laddering. So making sure that, if you're a CCA, you have opportunity to become an LPN. If you're an LPN, you have opportunity to become an RN. If you're an RN, you have opportunity to become a nurse practitioner. And that's really important because as you can career progress, then your opportunity to have more financial incentive also grows. So that's another strategy that we're using is career laddering. We do it in paramedics. We offered a new program called Emergency Medical Responder. If you're in the control center, you can go to be an emergency medical responder. Then you can go to become a primary care paramedic, and then you can be an advanced care paramedic. And all those ladderings have really helped. In regards to the paramedics, we have...
I'm so sorry. That concludes the Liberal round of questioning. We'll now move on to the Government Caucus, and 30 minutes will begin with MLA Burns.
Hi, good afternoon. Thank you all for coming in today, taking our questions. I just wanted to start by asking or commenting on retention and recruitment. So retention is just as critical as recruitment, and I wanted to ask what strategies are providing the most effective in keeping healthcare professionals here long term? We have programs like the Doctor Pension Plan. Are there other strategies that are in play that are helping keep healthcare professionals here?
ADM Barro.
So we do have several retention pieces that we work on. Back to the so return of service is one of the incentives that we utilize, particularly if we were giving government money and taxpayers' money for free tuition. We think it's very important that we have a return of service or something back to Nova Scotians. I will say that if although we may not track the amount, we do for physicians in physician services, so we know how many physicians break the return of service. Any practitioner that breaks the return of service has to pay back that return of service. So it's not like it's free money. They can leave the province and not have any repercussion for that. So we do feel that we're putting some pieces in there. In terms of the other incentives, like bridging programs are really important. Like I just said, the career laddering, making sure that there are incentives that we can support our healthcare practitioners to move in their career progression. The other areas would be around novel approaches to retention. So having, when we have the Physician Center of Excellence, one of the things that happens for those physicians is called the Welcome Collaborative. And that's an orientation program where they meet several of those physicians that are coming from other parts of the world, and they develop a little bit of a community of practice, and then they continue those things. I know in the Middleton area or whatever, we have a larger cadre of Nigerian physicians, and they have developed a little community amongst themselves. They help each other. So what we do know too with our incentive, our relationship with Lebanese universities, by having those physicians come in and be surrounded by the Lebanese community, helps with retention. As I said before, sometimes physicians don't feel, and I'll speak to physicians, that they find that here and they do break the return of service and they go elsewhere. But we do try several things to make sure that people feel that they're welcomed in community, that they build a community around them, that their children and their families can have people to talk to, sports to go into or whatever. So we do several of those more concierge services to ensure retention. So we try to look at it holistically. We even in the physician space do look to housing. So we do work with realtors around housing, et cetera. Now, physicians make a lot more money than lots of different practitioners, but certainly we do try to ensure that they will have spaces to live and they're going to communities to work and that they can thrive in those communities.
Thank you. MLA Burns.
Thank you. I think that really shows that retention really is holistic. Being part of your community and having roots in the community really help to keep people in the area. And certainly Nova Scotia has a lot to offer in that space. I'd like to move to asking Mr. Barro a couple of questions. I guess I would start with how many health programs does the college deliver, and are they available at each campus?
Mr. Bureaux.
Thank you, MLA Burns. I'm going to ask my colleague, our Dean of Health and Human Services, who has those numbers at the top of her list, so at her fingertips.
Ms. Fisher.
Thank you for the question. We have 19 core programs in the School of Health and Human Services, and 7 of those are sort of specific to health, and the balance would be more human services. And those span over the 12 different campuses and different deliveries. So CCA, for example, is offered at 12 different sites. Practical nursing is offered at 10 different sites. And then others are at single one-ofs, but we span the province in terms of the offerings.
MLA Burns.
Thank you. And can you speak a bit, give us some understanding and insight into what NSCC is doing to help in the healthcare sector, particularly with educating more learners faster in an urgent sector like healthcare through the programs that you're offering?
Ms. Fisher.
Thank you. So I would say a theme of expansion. So expansion in terms of increased seats related to practical nursing, related to pilots and innovative programming specific to practical nursing. So some of the accelerated, the CCA to PN Bridge programming, as well as acceleration. So we've worked in partnership with government on the CCA programming that this year is now a 26-week, 6-month program that was previously a 9-month program, and that's in delivery now at all of our campuses. So really working to support a competency framework that ensures that graduates are employment ready and connected to employers, so that we are creating programming that is concise and relevant and timely, and ensuring that we're providing sufficient experience for students in terms of simulation and clinical placements and applied learning. Additionally, we've done a adjustment around our disability support professionals, so that program in specific response to the Nova Scotia Remedy report, moved that from a 2-year program to a 1-year program, and just really working to try to understand the best possible outcomes for students and the best possible quality programming that is related to the skills and practices that they're needing, and in terms of their scope of practice and scope of employment in those regulated and unregulated health roles.
Thank you. MLA Burns.
Very good. Thank you very much for that. I'll pass my time to my colleagues.
MLA Bureaux. You look like you want to say something.
Thank you, Chair. And it's been a while. And it's my first meeting as a member of the Human Resource Committee, and this is a topic that's quite interesting to me. I am a healthcare provider, and my wife is a healthcare provider. And 5 years ago, maybe even a bit longer than that, when I was asked if I was interested in running as a candidate, one of the things that really interested me was the Premier's passion for looking at healthcare. And I wore a few different hats before I ran, and one of them was on healthcare recruitment. So some of you may be aware of Cape Breton South Recruiting for Health, but I was a town councillor, and at the time struggling with physician recruitment in the area, and so was kind of a co-founder of that organization. And when we talk about retention and we talk about the importance of retention, and I think of the funding that is provided to organizations like Cape Breton South Recruiting for Health, that they put on events to help with retention too. So give credit to certainly the department and the organizations involved, but certainly at the local level too. What an organization like Cape Breton South Recruiting for Health and their Community of Care Awards that they have, where they recognize healthcare practitioners in the community. And this is it's like a gala now. Like, it's a dress up invitation only to go, and it's quite something, but celebrating the healthcare workers in the community. So thank you to certainly the departments who support those initiatives at that local level as well. I have a couple of different questions, and I'm going to probably jump around a little bit to all of you. But there was a couple of things that interested me, and one of them was about the tuition support programs that we have, and some of them are for we've talked about some for healthcare, and maybe I don't know who would like to answer. Like, sometimes it's confusing because there's all kinds of them that there's tuition credit or support. Do we have a list of what those programs are, whether it's with the department or with the college? Which ones are supported that way, and are there other ones that are outside of healthcare as well?
So as you all flip through notes, I'll look for someone to raise their hand who would like to take the question. Mr. Bureau.
Certainly internally, we would be keeping a list of those programs for which there's some form of incentive. And I have it in front of me. We'd be more than happy to share that with the committee. It certainly is one part of the incentive package that is so important to attracting learners into our programs. As I mentioned earlier, housing is also a big one, but also items like helping to find, once they graduate NSCC and they go into the community to work, if they're moving communities, it's also important to try to perhaps find work for their spouse. So working with economic development agencies like the Halifax Partnership, the Cape Breton Partnership, to identify employers in the local area who may be looking for employees. So daycare is a very significant part of the incentive, if you will, package, and we've been very blessed by working with our government partners to make sure that our daycares at our campuses are strong and vibrant and be able to accept new children. And the last thing that I'll say, and my colleague Connie mentioned it, one of the most important factors of this is flexibility. There's a theme in education called meeting learners where they are. And you meet learners where they are, not only in terms of geography, but also in terms of timetables. So if they need to work part-time, then we need to adjust our programming to allow them to study at a different time of the day.
Emily Boudreau.
Anybody else care to share as well, or is it, I don't know if it's...
ADM Barro.
We have quite an extensive list of how we support our healthcare professionals. So what we do for physicians is that we have Nova Scotia funded residency seats. So we help Nova Scotians who are completing their medical school find residency matches and then to come back to Nova Scotia to practice. We have international medical graduate residency ROSAs, so we have 62 of the family medicine seats, 16 are for IMG students. So those are for Nova Scotia students that go abroad that want to come back into Nova Scotia because they often want to find pathways back home. So we do incentives to get them and help them come back to Nova Scotia to practice. We have a clerkship return of service, so we have a 2-year So we support participants to complete their 3rd and 4th year of their medical school and apply to the CARMS match, and we require a return of service for that one as well. We have a financial incentive for family medicine, so up to $125,000 over 5 years, again with a ROSA to come back to Nova Scotia or be in Nova Scotia, but to set up a practice in a rural area, or now we have them available for Central. And we have the same type of incentive for specialists to come back to Nova Scotia. We have for physicians, for paramedics, we have a paramedic moving allowance. So if they're coming from another area, we have a moving allowance for them. We actually have a moving allowance for physicians. CCAs, we cover tuition in exchange for students to work in Nova Scotia for 2 years after they're finished. We have a paramedic tuition bursary program that provides full tuition, and that has actually proven to be very successful, because when we started with physicians, with paramedics, my apologies, we had a very significant vacancy rate in Nova Scotia with regard to paramedics. And through the career laddering that I mentioned, through the free tuition, et cetera, we actually are projecting no vacancy rates in our paramedic community of practitioners. So we feel that that's very much a success, to the point where we're actually going to stop the tuition, free tuition, and maybe continue with other incentives. But we feel that that's been so successful. Right. So there's just a few of the ones. I could go on, but we have a lot of incentives.
A meeting ends at 3, so sorry. MLA Boudreau.
I think both have lists, and maybe if that's something that could be shared with the committee, that would be awesome, just so that we get a handle on it, because there's a significant number, and it's easy to get confused about what's there and what's not. But I'm going to go to the community college and ask another question, and just with some of the tuition incentive programs, but also with like some of the fast-paced changes that we've made with with programs, so intense programs. Have you seen a change in the demographic of the people who are in the programs now? Have we seen any shift in who's applying or who's coming, or do you track that? Do we know, has that changed based on some of the work that we've done?
Ms. Fisher.
Thank you. I think what we've anticipated with the free tuition or with funded programming is that we may or may not have a completely engaged student body, maybe concerned that there wasn't, full buy-in into the program if they weren't actually having to pay their own way, and I think we've been very, very, very impressed with the quality of the student in terms of their engagement, and in many cases the challenges and barriers that they would typically face related to things like housing, transportation, and childcare, and other barriers, cost of living, and so on. Those things are still influencing them, but what's happening is that students are very much engaged in their learning. The flexible programming that we've offered around blended deliveries, so where we're delivering programs that are online, and then they come into a campus or an area to complete their clinical, their labs, and then their placements. What we've seen is that students are very appreciative of the time and the flexibility and the models that we're piloting and trying, and really trying to be responsive to the needs of students, with a majority of them employed, high numbers of employment, and in some cases, for some of the programs, it's an actual requirement that they remain. For example, CCAs are remaining in continuing care employed while they're taking their PN program. They are needing to really be able to use their time in a way that is of value and be able to support their personal lives and their families. So they are engaged, and they are very, very they're very much invested, if you will, in the program and in their learning. Yeah.
Thank you. Emily Woodrow.
Yeah, I know. I could talk for quite a while, but I'll pass it on to my colleagues over here. So,
Emily Sheehy-Richard.
Thank you for giving me the opportunity to ask some questions. I've learned an awful lot in the office, and in this meeting today that always seems to reflect constituents that I'm currently helping. So that's my favorite part of coming to committee. We actually, as MLAs, learn a significant amount. My line of questioning was sort of covered, so I wanted to circle back on housing. Came up quite a few times, and I'm just curious about the opportunity for the I can't remember what it's called, the Housing for Healthcare Initiative. And you had mentioned, I think, in one of your opening remarks about working across different levels of government with Build Nova Scotia. So I'm just wondering if you could elaborate on that, where the locations are, and how that ties into recruitment and retention as well.
Thank you. ADM Barro. Ms. DeCoste.
Thank you so much. Thank you for the question. It certainly is all hands on deck on the housing front. As I mentioned earlier, we're working closely with our partners at local and provincial levels within health, but also with our employers like the Nova Scotia Health Authority, the IWK, Build Nova Scotia, Public Works. And there certainly is a focus on housing for healthcare workers. Right now, we're looking at what our data is telling us in terms of the need across different communities. Certainly, it's different, but as one of the members previously mentioned, it's a unique. It's unique maybe in each community, but certainly it's a universal challenge. In some of the smaller communities, I know that there are conversations underway with many not-for-profits, many other local partners who have an interest and a stake in supporting their healthcare workers and those members of their community with more sustainable housing options. We could certainly get back to you with more information, but we'd have to consult further with our colleagues at Build Nova Scotia.
MLA Sheehy-Richard.
And I know Mr. Bureau is probably anxious to answer this as well, because I'm curious on the NSCC campuses builds. Those were one of my most favorite, I think, announcements I've been involved with, having children, as I mentioned to you, that have gone through the system. And the big part of is that, you know, traveling's okay, but when you add the school commitments on top of that, it becomes somewhat of a bit of a barrier because they're tired, they're sitting in traffic when they could be using that resource. So if they had the opportunity when single units or campuses weren't necessarily available, are you seeing that is another incentive that is helping individuals get in both the trades that we need to build housing for our practitioners that we're attracting, but also more particular on the healthcare? Are you seeing a trend that it's helping individuals take the programming?
Mr. Bureau.
The answer is yes. The 5 residences that we have opened in the past couple of years, and again 4 more in the works, have absolutely been a game changer for students in terms of their learning experience. When I have roundtables with students, those that are living in residence, to your point, it just removes one more level of, I won't use the word stress, but consciousness that they can then take that time and energy and focus on their coursework. So at NSCC, we are becoming much more of an institution where people want to come, have that learning experience, and actually stay on campus. So I would say absolutely it's been a significant advantage for those students.
Thank you. MLA Sheehy-Richard.
And just on a follow-up, too, to just say thank you for that initiative supported. But again, you know, young individuals have a hard time, especially I have 3 boys, insurance on a car, having a reliable car to go the distance that's always needing upkeep. It's a more economical approach as well. So I'm pleased to hear that there's 5 open and 4 more in the works. I wasn't quite aware there was actually 5, so that's good to hear. I just want to roll into what the role of health professionals, seat expansion overall, like, I guess, how much student-led engagement is there when we're speaking about, when you talk about building the capacity, building the needs, monitoring the wait lists and what have you, but are you hearing students' voices involved in some of these decision makings? And I think I could hear from both of you on that, if you will.
Sure. Deputy Barbrick.
Thanks. I'm happy to start. So the Department of Advanced Ed has a number of student roundtables, so 4 different student roundtables where we're meeting with them regularly about their needs as students and their interest as students. So some of that has been some of the programs that have been outlined here around accelerated programs. We have programs that are running evenings and weekends for maybe young people or people who are in a particular profession. They want to upskill, but they need to continue to earn an income. So they've, opportunities for things to be a bit more flexible. Bridging programs, I think, are, have been highlighted. But because I wore the seniors and long-term care hat for about 4 years, the work there to allow individuals to stack and make more money over time and find that upgrading flexibility to allow them to continue to work. So the CCA to LPN pathway, LPN to RN prescribing programs that are new in the system, physician assistant programs. If we step back just a second, we have added 600 new healthcare education seats in this province in the last 4 years. So that's nursing, that's physicians, that's CCAs, that's LPNs, that's these transition programs. We also the doctorate of psychology around children. There's just, we have had expansion in post-secondary that had been really was lagging, and the investment to move this along. Student housing, the other piece on top of the NSCC residents that were identified. We've also done residence investments at Cape Breton University, residence investments at the Gaelic College, and continuing to kind of look for opportunities there. There's a new sustainable housing fund that was announced a year ago, $45 million, that requires a component that's for student housing, that's affordable housing locked in for 20 years. So that fund was opened a year ago. There are applications under review with specifically affordable housing for students as part of it. So if you look at that as a whole picture, we've had, what supports families to go back to school. Very few people can afford to just step out of their workplace and go into school. So finding ways to provide more affordable childcare, affordable housing, adapting ways that we educate people so that a pathway to education is not maybe what it was when you finished high school, you did a 4-year degree and whatever it was that you did after that. We have to be more creative and allow stacking for individuals to both make more money and advance in their career. And I think that an awful lot of the pilots that we've talked about, we're trying pilots of accelerated classes. Do students want that? Are they prepared to do a 4-year nursing degree in 3? That's an intense commitment to do. We can't take that lightly. So the need to evaluate, run those programs. We've got programs right now with NSCC for skilled trades where students in high school are actually starting to take some of their skilled trades credits at NSCC before they even leave high school. We've got to try those things, evaluate them, see if they work. Are students successful? So all of that is adapting to what is a different way of educating people from 18 years old to 65 or 75 years old.
Emily Sheehy-Richard, I believe Mr. Bureau wanted to make a comment. Mr. Bureau.
Thank you, Mr. Chair. I can't overstress the importance of the voice of the learner and the voice of the student and how we design programs. At NSCC, our governance model includes students on our Board of Governors. They bring a lens to that important governance work. They also sit on our programs committee. Again, that lens is brought. But that voice of the student is heard in other ways too. The third leg of this stool, post-secondary government, the third leg, of course, is industry. And when students do their clinicals, they do their work terms, they bring back with them their experience. and that experience is often areas where improvements or changes can be made, and it's incumbent upon us to work with our industry partners to create a career journey that is one in which individuals want to pursue. So flexibility in learning, also flexibility in career paths and work schedules is also a very important part, again, shaped by the voice of the student.
Thank you. MLA Sheehy-Richard with 2 minutes and 25 seconds.
I think what I like the best about being a second-term MLA is actually remembering back to first term when some of these initiatives started. And then now, I mean, I have a 20-year RN that worked at my community hospital that is now the new full-time nurse practitioner at one of the practices that lost a family doctor. So there's 2 nurse practitioners running the clinic now, supported by Nova Scotia Health. And another really warming story is, and she'll be proud of me for saying it because she was so proud of herself, worked in the cafeteria at our Hants Community Hospital for I think, 20 years. Her children are my children's age, and she has always wanted to be a CCA. She has always wanted to, but she was financially committed. So the opportunity for her to have the tuition paid was the most incredible thing, and I'm proud to say that both of those stories have graduated and are doing well. And I think you'll see her move up to a licensed practical nurse the next one. Yes. Did I say it right? Okay. And I just want to ask a question that might be silly of me, but I'm curious about when you have a family practice nurse, that model, is that an RN or is that another bridge?
Deputy Barbrick with 50 seconds.
Yes, all of us could chime in on this one, I'm sure. Yeah, that's the next level beyond RN as a nurse practitioner. So more and more part of collaborative practices. I'm in the wrong swim lane here, but certainly, like my family doctor was a solo physician for the last 25 years. He's been my doctor. He now works in a practice with 2 other physicians, a dietitian, a social worker, and a nurse practitioner. That he's been a practicing family physician for 30 years. And now when you visit that center compared to his old solo practice, he's referring within that family of professionals to support his practice so he can carry a larger panel and support the patient more holistically. So all of those kind of iterations, the nurse practitioner.
We will now move on to our second round of questioning. It'll be 6 minutes for each of the opposition caucuses and then 12 minutes for the government. We'll move on to MLA Gallagher.
Thank you, Chair. It's always so shocking when he says order too, doesn't it? It always really throws you off. You, ADM Barro and Ms. DeCoste, you spoke earlier about, the ladder, the career ladder, and, the LPNs going on to become RNs, and I think that's really great, but we may have missed a rung on that career ladder, and that's midwifery. And I never passed down an opportunity to talk about midwives because they were very important in my life. They gave excellent prenatal and 4th trimester care. And I was one of the lucky ones that got one. And since 2021, we've only increased midwives from 16 to 19 in our province. And unfortunately, last year, our wait list for midwife care was at 264. So I'm curious what the department is doing to retain, train, incentivize midwives to provide care to Nova Scotians who are looking to access during their pregnancy.
Ms. DeCoste.
Thank you so much for the question, and we certainly do want to acknowledge the important work that midwives do in the province and across the world, really, in supporting women during vulnerable times. I think one of the things that we can say certainly about midwifery is one of the things we want to make sure that we do with any health profession is really make sure that we have the appropriate legislative framework that will allow any profession, including midwives, to really bring that profession to its most modern state and be able to really expand scopes of practice, for example, to bring Nova Scotia up to par with national standards and with some of the other work in other provinces that we're always looking to see what's happening around us. So we're happy to say that in 2026, we'll be migrating the current Midwifery Act to the Regulated Health Professions Act, a new legislative framework that all of our health professions, regulated health professions in the province are going to be covered under, with perhaps a few exceptions. And that will actually give us the framework to really start to modernize the scope of midwifery with partners in the industry. And that will allow us to really start to have some of these conversations, because we know, of course, it's not just the legislation, it's the hard work after that context is set, with partners to understand the full suite of opportunities in that space. Scope of practice, which may mean changes to education, training, and of course, as you've alluded to, ultimately understanding what the service need is in our communities. We certainly hear from our communities about the opportunities that are present for more midwifery services, so we'll be looking to better understand that with our partners at Nova Scotia Health, at the IWK and others, to really start to map that out. So that legislative change will start to lay the groundwork for us to do more in that space. Thank you.
MLA Gallagher, ADM Barro would like to comment. ADM Barro.
And one of the advantages of the legislative framework for midwifery is they're joining the College of Nursing. So they're going to be part of that broader nursing, which I think will help us accelerate how we understand and utilize midwives better in Nova Scotia.
Great, thank you. MLA Gallagher.
Thank you very much. It's almost like you knew I was going to ask that question, because now I have some more questions. Do you know how many midwives Nova Scotians would need to eliminate that wait list?
Ms. DeCoste?
Yeah, thank you so much. We're in the process of getting a grip on that situation, so that when we move into the legislative work, we can really understand what's our current state and where do we need to go. And we really want to make sure that we're planning appropriately for the role of the midwife in our health system. We have many other health professions, of course, that are working in the domain, and we want to make sure that we're using them to the optimal scope, as we are with physicians, nurses, nurse practitioners, et cetera. So there's a lot of planning work to come. Unfortunately, I'm not able to give that level of detail right now.
MLA Gallagher.
264 people on that wait list, so there's definitely a need and an excitement about midwifery. So I look forward to hearing more. In 2022, let's back up a little bit. I'm not sure if everyone knows the closest place that someone could be trained for midwifery in Atlantic Canada is Quebec, actually. And in 2022, Newfoundland recognized that people were leaving their province to go get trained to be a midwife. So they initiated a study to determine where in Atlantic Canada a midwifery education program would work. In May of this year, the CBC published a story suggesting that the Mount St. Vincent or Cape Breton University could host a midwifery training program. And I'm curious if the Department of Advanced Education is working on this opportunity with these schools.
Deputy Barbrick, 20 seconds.
Yeah, thanks for the question. We and Department of Health and Office of Healthcare Recruitment work very closely on the practice models in Nova Scotia and what that leads to in terms of need for post-secondary. What our post-secondary institutions have proven to us over the last few years is that they're in the game for what we need. So for midwifery...
Order. I tried to do that softer that time. MLA Mumbercat.
Thank you, Mr. Chair. And I know I only have a few minutes of time to ask questions, but I am going to take this moment to recognize Mr. Barro, who, after 15 years at the helm of NSCC, is moving on to new adventures. So I can say, on a personal level, I worked with Mr. Barro as an employee way back when. There was a lot of excitement the day we broke ground on the community college in Sydney. A lot of excitement around the conversations about expanding childcare and other programs and the trades around the province and my various roles here. And through all the discussions, and you hear it whether I was on this side or that side, you always reference the student voice, that the student voice matters so much in the conversation, because ultimately we all want to do what's very best for the students that are studying. Not only can they enhance their educational journey, but support their families. So on behalf of all of us, I do want to recognize you for your leadership, your friendship, and we wish you all the very best in what's next. So to you, Mr. Barro. So, is there a residence coming to Sydney? That's my question.
Soften you up. Mr. Bureau?
Our next 4 that we have in the works, Sydney is not on that list, but never say never. That would be something that perhaps the next president can work with our partners on to secure.
MLA Mumbercat.
Thank you, Mr. Chair. And my next question I'm going to ask is around just around the practical nursing program. Is there a wait list right now?
Deputy Barbrick can begin.
Sure. So I was going to introduce the fact that Nova Scotia Community College is our only provider of LPN programs across the province, and we have added a version of 300 seats over the last few years. We have been working with NSCC around that wait list and targeting expansion based on where those wait lists sit, and I will turn it to my colleague at NSCC who can give a good snapshot of current state.
Ms. Fisher.
Thank you. Yes, so currently we are waitlisted for fall 26 at all of our campuses, so all 10 sites, and this is a very fluid wait list. So as applications are processed, as individuals complete requirements for the program, there's a lot of movement of that wait list. So we currently have a wait list of 485 students. But we are in the process regularly. Our admissions team works through each campus location to assess the number of applications that are in process, and while there are active offers out, new applications are then placed on the wait list. So it's not necessarily a realistic picture of how many individuals are beyond the capacity that we currently have. So we're not completely full in the sections. So it's a complexity of having folks on a wait list, but the section is actually not completely full to capacity. So it's a process that our admissions team works through as they're juggling the numerous applications that they get for practical nursing. So.
Thank you. MLA Mumbercat with minute and 50.
Yep,
yep. Deputy Barbrick.
Just add too, recognition. So in 2023, we had 145 LPN seats. We now have 445. So in 3 years, we have added 300 LPN seats across this province. It's pretty incredible. So I know one of the things that have to happen is it's not just a magic switch to add seating capacity. That means, staffing up for NSCC. It means physical space. It means lab space. So there are a whole bunch of things that go along with the decision to add seats. And so that expansion is among all of the expansion. We've had lots of expansion in RN, but LPN seat is the most kind of impressive growth to meet that need. So we'll continue to evaluate over that time to see what NSCC has capacity for and what those wait lists and where we start to level out. Eventually, we will start to level out.
Emily Member Cat, 50 seconds.
50 seconds, okay. I want to ask a question because I know I won't get an answer. I'll just reiterate, one of the biggest things that we hear, regardless whether it's this program or not, wait lists are a big concern, of course, and I know that the department and the school and the college are working through it. I think the biggest thing is expanding across the province, giving those families the ability to not have to travel. And we're talking healthcare today. There's a vast array of programs, you know, where whether it's in human services or the trades or wherever, I hear that the most is that like these families want to attend the school, they have the credentials to attend the school, but the traveling can be a barrier. And I know you can't put every program everywhere, but like if, for example, particularly around this area, the more flexibility, the better. Thanks.
That concludes the opposition round of questioning. We'll move on to the governing caucus. MLA Fathere.
Thank you, everyone. First of all, I want to echo my colleague to say a big congratulations and thank you for the incredible work you've done in the last 15 years. I was going to say that, but I guess you beat me to it. Obviously, I think what we heard today is whether we like it or not, regardless of whether you're in the opposition or in government, I think this is impressive. We definitely have what I refer to a nimble, agile team around this table who are working around this healthcare, whether as practitioners or as partners or as government. I think it's something that we need to really be proud of. Just hearing the incredible numbers, the growth that has taken place. I know that there are people who might feel otherwise, but I think that it's always very good to celebrate, when you see progress. They say that that is always very good. I know that we've talked today about. I know that I have a lot of interactions with a lot of doctors, and it's some of those big concerns and all that. We've talked about different initiatives. I'm just curious about. We've talked about the career ladder. We've talked about flexible programming. We've talked about different incentives that we've put. I'm just curious, what do we think has been the most effective in retention, of healthcare professionals here in Nova Scotia? I know recruitment is good, is great. I remember over the weekend I was in a garden with a couple of doctor friends, and I was just trying to, we were trying to integrate. We especially ones we just learned a few months back, and they were talking about a couple of new doctors coming in from UK, soon, and I was really excited about that. But I'm just wondering, they were talking about how great our recruitment has been. I'm just wondering, what's been the most effective of all the initiatives we have in retaining these healthcare professionals within Nova Scotia? I'd love to hear from either the ADM or
Ms. DeCoste.
Thank you so much for your question. I can get us started, and perhaps my colleagues will weigh in further. That's a great question. There's been so much effort and investment in keeping our healthcare professionals here. We had some good discussion earlier about the fact that one indicator of keeping people here in the province is that they're here, they're from Nova Scotia or from the region already. We're seeing really strong retention rates in a number of our health education programs, including in family medicine and in specialties at Dalhousie in terms of the medical profession. We see that there's a huge indicator of someone who is from a community wanting to stay in that community and having family and friends surrounding them. We certainly, as you've alluded to, we are doing a lot in the international recruitment space as well. One of the things that we've seen work well, a few things, return of service agreements that we've put in place where we've provided additional supports to physicians, for example, coming internationally where they've had an accelerated pathway to licensure, whether through the Physician Assessment Center of Excellence or through other pathways where our College of Physicians and Surgeons has designated different pathways where they've said that the practice in a country like the UK or the US is more or less equivalent to a practicing physician here, and so that's made the process faster. Where we've provided some incentives like relocation supports or other incentives, as my colleague mentioned, to practice in rural communities, we've often tied a return of service agreement to that. that really helps the person land in the community where the system needs them most. But then it's through partnership with community at the local level, whether that's through consulate offices or other diaspora communities, or through funding, like one of the members referenced, on the ground local initiatives to really figure out what's best and most effective in those communities to help wrap around those folks and their families once they get here. I would say that those kinds of things at the local level have probably had a substantial impact, because we know it's that day-to-day community experience that is really making a place feel like home, and that's really probably our most successful investment so far. Return of service agreements are one instrument that help us get the person here and to the place we need, but it's really our partnerships with local community and those wraparound supports that help them stay. My colleagues may have something to add. No? Thanks.
Emily Feathery, we'll move that on to ADM Barro.
Yes. Thank you. Thank you for the question. So we do, and MLA Boudreau mentioned some. So we have a community fund that actually helps support community groups to provide supports to ensure that we have things for retention. So we have invested in that fund, and we've had great proposals from communities, and that is really helping for retention. So it's a combination of things, but we've kind of looked at it from many angles, and that supporting community organizations has been very important.
MLA Feathery.
I agree with you, because I'm very aware about that. Over the weekend, like I was alluding to earlier, I was with a couple of doctors, and one of them said something I think for me was profound. In 2019, he was planning to leave Nova Scotia to obviously one of those bigger cities. But he stayed, and he was talking about the fact about the new agreement that was signed. And for the very first time, I heard the doctor talk about being satisfied with the pay, and he was talking about how Nova Scotia was one of the very lowest at some point in time, and that's no longer the case. And for him, in particular, his wife is a pharmacist who originally couldn't work when they were here, but now she's able to practice because of some of those initiatives. These are real people, real story, real life, and all of that. So I really think this conversation is really exciting for me, because I see these people in communities. I meet these people, have this kind of conversation. My question, probably last, I'm not sure how many seconds I have left. I know one of them, I talked about the various programs that we've had and how engaging it's been. I wanted to ask, probably to NCC, have you, regarding the people who are coming into these programs, right? Are they more matured students? Are they? I'm trying to find out who exactly is accessing those programs. I'm curious, are there people who are already working within the healthcare system? Are they rural learners? As in, who are those exactly? Are they people who are closer home? Do you have such statistics or data that you can share with the community today?
Mr. Bureau?
So today I'd have to report anecdotally. I can see, member, if we can get some data to back it up. I will say, though, that this program, these incentives absolutely increases the diversity of the programs. And what we're seeing, as was mentioned earlier, are people who have faced traditional barriers are now having those barriers removed. And in many cases, they are older, if you will, learners than the typical, quote-unquote, post-secondary student. The average age of an NSCC student is 26 years old. We're getting a larger share of the high school graduation market, so in order to draw that number to 26, we're also, therefore, must be getting more, again, quote, much younger than me, but more mature, if you will, students in their 20s, 30s, and beyond. And what's happening is, as the economy continues to adjust, impacts with AI that I think are very positive, it's changing the nature of the occupations that exist. And now with these opportunities, a person can leave one occupation and be retrained and pursue a different career. So more diversity, both in age, ethnic background, and geography is something that we're seeing with these programs. Yeah.
Thank you. MLA Fatheray with 3 minutes, 20 seconds.
Oh, it's 3 minutes. Okay, that's good. I wasn't sure how many seconds I still had or so that's really good. Obviously, I think what we're hearing today is if we remove tuition barriers, if we remove and we offer the incentives that we're offering, remove barriers from housing, we create opportunity for access, for people to, close home to attend, that we're going to see diversity, we're going to see more matured people, we're also going to see, because one of the things about when you bring in an healthcare professional, especially a physician, you're not just bringing a person, and what I'm hearing is the holistic support that they seem to get, the fact that they're coming with their wife, they're coming with spouse or whatever, significant other, they're coming with their children. That means there's a lot of investments that need to go into all of that, and I think it's pretty exciting. So for me, I'm really excited about this, and I think that everybody on this side of the aisle is really, 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 really proud. So let me look for my last question. So I want to say we've heard about free tuition programs. We've raised concern about children might not be engaged. The question I want to ask, have you noticed any shift in which applying for this program? Oh, sorry, I asked that earlier, sorry. Give me a second. Can I turn on my
I can talk.
So,
thank you.
So MLA Boudreau?
Yes, please.
Okay, MLA Boudreau.
Thank you, Chair, and I know I only have a short time, and I won't probably get to a question, so you guys can relax. But I think when we talk about incentives and we talk about retention, my wife and I were both healthcare providers in Ontario. We moved back, and I moved to start my own practice. But my wife walked into the community we were looking at, walked into 3 pharmacies, was offered 3 jobs. Like, it was in such high demand 15 years ago when we moved back, and. But what we've done, not only in the public sector, because my wife and I both work in the private sector, but we've also developed an opportunity for us to work to our full scopes of practice. So if you think about a pharmacist and what they can do in Nova Scotia right now, there are no better qualified, and there's nowhere else in this country can you do what they do here in Nova Scotia. We're letting them do to their full scope. And one of the other things, I'm a chiropractor, and chiropractors and physiotherapists, we have the scope to order x-rays. We never could in Nova Scotia. But guess what? Now, physiotherapists and chiropractors can order x-rays, which means we're not burdening sending back to a physician to have that, to wait 3 weeks to go get an x-ray. We can do that now because that's part of our scope. So I think if you talk about incentives, giving us the opportunity to do what we were trained to do, that's what's going to keep people here. Because if they can't do that, they're going to go somewhere else. So how much time do I have left?
None.
5 seconds.
Okay, thank you for the opportunity to say a few words.
A seasoned pro right there. Very good.
I was waiting.
So what a wonderful conversation this afternoon. Thank you so much for being with us. We will give our guests an opportunity to give some closing remarks. We'll begin with Deputy Barbrick.
Thank you for the conversation today. I would frame recruitment and retention as an ecosystem. So we need to educate what we need in all the ways that can be flexible for students. We need to recruit locally, domestically, internationally in lots of different ways, and we need to retain through wages and safety and laddering and all of those things. Little story, because I'm a proud mom, my daughter graduated in the spring as a radiation technologist. She started working for Nova Scotia Health back in the spring. She was a student on a work placement for her final 2 years, which is what hooked her. It was easy for her to get licensed once she finished her education. She got a a return of service contract, and now what will keep this smart 22-year-old in Nova Scotia is the chance to ladder and change her career over time. So that's what we're going for, is the whole ecosystem for every single person that we need in healthcare.
Thank you. ADM Barro.
Thank you. It was a pleasure to come talk to you about all the different things that we're doing. We do feel that We have developed a well-rounded strategy, and one thing we didn't get to mention is that the backbone of all of this is health workforce planning. And we've done a ton of work to try to understand what is our need through the changing demographics in our communities, our age, the health status, et cetera, and then build programs and new novel approaches to make sure, because our goal is to have sustained healthcare professionals for Nova Scotians today and in the future. With the education seats, that's more of a long-term approach to things, but we're doing several things right now to try to do things. The scope of practice has been huge. I agree, MLA Boudreau. That's one of the major things that we've done in Nova Scotia. Unlike a lot of provinces in Canada, people can come here and work to their scope of practice. We've introduced new practitioners like the medical responders and physician assistants. That again, we've even the expansion of the scope of the NP enables less pressure on physicians. We can have a much more well-rounded team. So we do workforce planning. We're trying our best to do a well-rounded, robust, and I think we're working very well as a system with our government partners and our community colleges, et cetera, to do what we need to do to make sure the healthcare Nova Scotians get the health care they deserve. It's not perfect, but I feel we're doing the best we can.
Thank you very much. Mr. Bureau.
Thank you, Mr. Chair. I have a very, very articulate closing remarks here prepared for me. I'm not going to read it because this will probably be my last time at this table in this current role, so I want to do a couple of things in the minute or two that I have. First is express my appreciation for coming here today in the interest of our elected officials in your important work. Thank you. One of the most important themes that I heard today is that it's fine to train or to recruit, but we have to retain our health professionals in this province. And one of the ways that we retain health professionals and other professionals is having a prosperous province economically and a prosperous province socially. And I'm very bullish on what's going to be happening in this province. The increased military spending, the focus on energy, the amazing workforce that we have from our post-secondary institutions. I think Nova Scotia is set up to be a destination of choice for healthcare workers and a destination to stay in Nova Scotia. So I'm very excited about the work that's ahead of us. I do also want to thank my colleagues that are at the table today for their hard work and their let's get it done attitude and their openness to creativity, innovation, and collaboration. Thank you.
Thank you, Mr. Bureau. One more time, my few years as chair on this committee, you've probably been the most person that's appeared most than anybody. So it's been a privilege having you. It's been a privilege having you at our table. And thank you again to all of our guests today. We're going to take a 2-minute recess to allow our guests to leave, and then we'll have to come back for a bit of committee business quickly. So thank you once again. I'll be staying in recess. Yeah. All right, if I could call our committee members back to the table. We have just a bit of committee business. It was a deferred NDP motion from our last meeting, and I'd like to ask MLA Wozni to please repeat the motion, or read the motion again for the record so we can all have that fresh, please.
Whereas Nova Scotia has some of the highest child care fees in the country, with families paying more than $20 a day, and whereas the responsible minister has admitted that families will not see their child care costs drop to $10 a day by the spring, as was previously announced, and whereas by not lowering fees to $10 a day, families will spend thousands of dollars more on child care each year than parents in other provinces. Therefore, I move that the Standing Committee on Human Resources affirm its support for the delivery of, on average, $10 a day child care for Nova Scotian parents by April 2026, and request a clear plan outlining the steps that will be taken to meet our target of $10 a day child care for all parents and the creation of over 9,500 child care spaces.
Thank you, MLA Wozni. Any discussion about the motion? MLA Gallagher.
Thank you very much, Chair. I just want to say that I'm a mother of a child who recently just aged out of a daycare setting, and so I'm very familiar that Nova Scotia has some of the highest childcare fees in the country, and families are paying more than in Nova Scotia than they do in Charlottetown or in St. John's. And in this time of families' bills raising and going higher and higher, some folks have to make hard decisions and to make ends meet. And I think the government should be making sure they're doing everything they can to make sure that parents can afford the care that their children need. Thank you, Chair.
Thank you. MLA Barbrick.
Thank you. Thank you, Mr. Chair. Call question.
All those in favor of the motion, say aye. Aye. All those opposed, nay. Nay. Motion is defeated. Without any other committee business, our next meeting will be in January, and that will be our last topic for this round of agenda. And then I will ask all of our caucuses to have your topics for our February 3rd will be agenda setting. So all of our caucuses to please have your topics submitted to the clerk by January 20th. Please, so that way we have everything ready for our agenda setting meeting on February 3rd. So with that, we stand adjourned. Thank you. Merry Christmas.